You've just released a new healthcare plan, and I'm a little bit confused about where you stand. First, I want to play clips from 2 of your ads where you talk about healthcare.
We need to move towards a Medicare For All system where every American has access to quality and affordable services.
His ideas are a blueprint for a new way forward, a healthcare system with Medicare For All.
But I've looked at your healthcare plan. In fact, I've got it right here. And this plan does not call for Medicare for all. In fact, it doesn't even have a public option. So why the dissonance here?
We need to move towards universal health care that's high quality and nearly cost-free for Americans around the country. But reality is we have millions of Americans who are on private insurance right now, and taking those plans away from them very quickly would be untenable for many, many Americans. To me, the goal of the government has to be to demonstrate that we can outcompete private plans and then push them out of the market over time. And that's what we're proposing.
But I'm confused. Your ad is explicit. Your ad says Medicare for all. Your plan is not Medicare for all. It's not even Medicare for some, because in your plan there's not even a public option.
Our plan is to expand a universal health care system to all Americans. Medicare for all is not the name of a bill. Medicare for all is universal health care for all Americans.
But Medicare for all is Medicare for all, right? I mean...
Well, our health care plan would be based on Medicare and expanding it over time to more and more Americans. You lower the eligibility age and then you make it widely accessible.
Okay, I didn't see that in your plan.
How do you support Medicare for all and not outlaw private insurance?
Well, there's a way to provide Medicare for all that does not prohibit private insurance. And the goal has to be to demonstrate to the American people that this Medicare plan is superior to your current insurance. Pause it for 1 second.
Now, there is a specific bill that is in the House and a specific bill that is in the Senate that defines what Medicare for all is. We're going to find out what Andrew Yang's definition of Medicare for all is. And I am of the mind that there is a way to have a Medicare for all bill like those 2 in which you don't have to explicitly outlaw private insurance. You simply say that doctors to be eligible for licensing or whatever mechanism you use must take a certain percentage of Medicare patients, and that everyone in the country has to pay the tax. Therefore, thereby making private insurance literally obsolete. Maybe a few instances where people want it, just in the same way that you might want to buy like a lucky rabbit's foot or something like that. But it will be basically obsolete. And therefore, you don't have to outlaw it. Is that what he's going to say?
Wait. Can I take a wild guess before we play it?
What he's going to say?
Yeah. Is he going to redefine Medicare for all to mean giving everyone $1,000 a month? Because I kind of feel like that's where he goes.
I don't think so.
Superior to your current insurance without pulling the rug out from under you and saying that the insurance no longer exists.
Bernie Sanders' own campaign manager said about your stance on this, come on, you either take on corporate greed that rots the system or you don't. That you're calling this Medicare for all, but when you ask about the substance, you still want to keep private insurance, which is not Medicare for all. How do you respond?
It's funny because we had an internal debate about this. Like, what does Medicare for all mean? If you look at it, what does it say? Medicare for all, which means that you have a Medicare program that everyone can be enrolled in.
So you're adopting the label, but not the bill?
That's correct.
Is that a little disingenuous to people looking for that, that flavor of a Democratic candidate, but with, if they don't know the substance of your plan?
Well, we're clear about the substance of our plan in various places, and we're going to have a more detailed rollout of the full plan in the days to come.